You are watching this week's segment of Health Talk, powered by HCN. This week, we're going to talk about an infection that's commonly recognized in the elderly, UTIs, also known as urinary tract infections. Urinary tract infections aren't just a nuisance in the senior population. If left untreated, they can actually cause some very serious problems. A UTI occurs when the bacteria in the urethra, bladder, or kidney multiplies in the urine. If left untreated, this could potentially cause acute or chronic kidney infections, which could permanently damage those organs and also lead to kidney failure. UTIs are also one of the leading causes of sepsis, which could be very life-threatening. According to the National Institute of Health, some of the following conditions can cause your elderly or your loved one to be prone to a UTI, such as diabetes, urine retention, the use of a urinary catheter, bowel continence. Actually, speaking of bowels, one of the commonly known bacteria in your bowels are E. coli, which is responsible for a UTI. An enlarged prostate, immobility, meaning someone who lies in bed for long periods of time. Also, anyone who's had surgery around the bladder or kidney stones. People that are incontinent are actually at a more increased high risk of a UTI due to the close contact of the briefs and the adult skin. Now, briefs are good and they do contain messes, of course. However, you're more prone to be introduced to a bacteria because of the confinement. Women are more prone to a UTI due to the urethra being shorter and making it easy for the bacteria to travel to the bladder. So what are typical symptoms of a UTI? I'm glad you asked. If you notice that the urine is dark or cloudy, if you notice that there's a very strong and foul smell, if you possibly have blood in your urine, if it causes pain while you urinate, if you have any pressure in your lower abdomen, or if you have that certain urge, a constant urge to urinate, that could be a sign of a UTI. Other signs of an infection or a UTI in a senior citizen would include confusion, agitation, hallucination, unusual behavior changes, dizziness, maybe poor motor skills, or falling. If you notice any of these signs, it is best for you to call your loved one's PCP and get them tested for an infection or a UTI. So let's talk about a few tips on how to prevent a UTI. For one, drink plenty of fluids. A good 2 to 4 quarts of water a day is perfect, unless otherwise advised by your physician. For two, also make sure to drink cranberry juice or take cranberry tablets. Please avoid or limit the use of alcohol and caffeine. If you're female, do not dish, and also remember to wipe from front to back. If incontinence is not an issue, make sure to wear breathable underwear and change them at least once a day. Now, if incontinence is an issue, be sure to change the briefs frequently. And also, keep the genital area dry and clean at all times. So about a urinary tract infection. It happens. It's common. Something that we all experience at all ages. However, our significant seniors are more prone to UTIs for the reasons that I've given you today in this video. If you're taking care of your loved one, or if you are a senior citizen and you've noticed some of the symptoms and the signs that I've listed today, please contact your physician immediately so that we can take care of that infection. You do not want this to lead to kidney failure. I hope that this message has been very informative for you. This week on Home Care Network's Facebook page, we asked a question. Should older adults get A, more sleep, B, less sleep, or C, the same amount of sleep as younger adults? What was your answer? I'll wait. answered C, the same amount, you are correct. Older adults need the same amount of sleep as younger adults. A good 7 to 9 hours a night is ideal. However, our significant seniors are actually getting less sleep than that. So let's ensure that they get the sleep that they need. So let's talk COVID. Are you vaccinated? Have you received the vaccine yet? What are you waiting on? Our numbers are decreasing in the county. The number of deaths are decreasing tremendously in the county, which is amazing. However, we still need to do our part. Wash our hands, wear our mask, social distance 6 feet, and also, if you can, get vaccinated. Hey, we're now open to where all adults are eligible for vaccination. You don't have to qualify to be in a certain group. All you have to do is just find a health clinic near you that's giving out the vaccines. Take that chance. Save a life, yours and those around you. Have you liked us on Facebook yet? Or have you followed us on Instagram? Have you subscribed to our YouTube channel? What are you waiting on? Go ahead, go on your Facebook page, type Home Care Network, 3 words, and follow us on Facebook, Instagram, and of course, subscribe to our YouTube channel. That is going to conclude this week's segment of Health Talk, powered by HCN. Enjoy your blessings.